The following is an illustrative case of cervical stenosis from ossification of the posterior longitudinal ligament, OPLL. This is a 56-year-old man who presented to the office with quadriparesis. He had had a 3 to 4 month history of numbness, weakness, diffusely in his arms, legs, hands. He was referred by a pain management doctor. He stated his balance was off and he was stumbling. And the problem was he was falling at work and he felt like things were getting worse. Past medical history, hypertension, vocal cord surgery. On examination, the most significant finding was the fact that he was cruising while he walked. Basically, he was walking like a toddler due to his ataxia. He had to hold on to the walls, the furniture. Otherwise, he was stumbling and he couldn't walk. He didn't have gross weakness of his extremities, but he had severe ataxia. His x-rays are here for your review, both AP and lateral view. On the AP film, relatively normal appearing. On the lateral view, what's most significant is this white line here, which is basically the x-ray portion of the OPLL. You can see it here on the lateral view on the x-ray. Otherwise, discs and vertebral bodies relatively normal appearing. Flexion extension views showed no significant instability. On the MRI scan on the sagittal cut, you can see here a black line, which is the cortical bone from the OPLL, posterior to the vertebral bodies and into the spinal canal, starting almost at C1 and causing severe spinal stenosis. You can see here some spinal cord signal change of the spinal cord itself. These are just the more parasagittal cuts. The entire cervical spine is involved. These are the CAT scans, CT scans of the cervical spine as well. As you can see, the same black line that I pointed out to in the MRI now is very clearly shown on the CAT scan, and this is the OPLL. And you can see how extensive it is, and it goes all the way down to the spine, to the cervical thoracic junction almost. So here's the MRI scan. You see it says a black line posterior to the vertebral bodies, and here's the CAT scan, which due to the fact that it's a CAT scan, it shows up white and it's very clear. This is another parasagittal cut, which shows more of the OPLL. Also, what's interesting in the OPLL is that it evolves, and that there are areas that are calcified and there are areas that are not calcified. More views. You can see here that some of this is not calcified in the middle. More views again. What else is interesting is that the disc space of the OPLL here is spared. Sort of interesting. More views. You can see the extensive OPLL. You can pause it if you want to look at it in more details. These are the axial cuts of the CAT scan, and this is at the level of C2. You can see the top of the dens there, and this is the ossification of the posterior longitudinal ligament here. And you can see this part of the OPLL is broad base, and this is more of a pedunculated sort of area. And this is, you can see the bifurcation of C2. This is at a very high level in the cervical spine. This is at the level of the C3 pedicle. This is the level of C4 pedicle, and you see how large this piece of OPLL is compressing the spinal cord. Again, same findings. This is the same thing now, but the MRI axial cut, and this is what the spinal cord here and the spinal canal should look like, a nice round object. C2, C3 here, near the disc space, you can see here that the spinal cord is compressed at this level due to the OPLL. Similar findings at C3, C4, C4, C5, C5, C6, C6, C7, mostly on the left. At T1, there's a reasonable amount of area for the spinal cord. So in essence, diffuse cervical stenosis from C2 to C7, and the operative plan was C2 to C7 and a laminoplasty. He was taking the surgery urgently due to his gross ataxia. In around the next week, and this is the level of C2. You can see here the laminoplasty plate and the spinal canal now has been opened, and this is where the spinal cord is. This is immediately post-op. That's why you can see here air within the soft tissues. Again, spinal cord now has plenty of room. Here's a laminoplasty. The hinge side was here, and this is the opening side. That's C3. Again, C4, C5, C6. At C7, the hinge grossly broke, and I had to perform a laminectomy at that level. T1. Due to the fact that I suffered an inadvertent C7 laminar fracture, I elected to fuse from C6 to T1 with allografted bone morphogenic protein. Again, this is the post-op CAT scan. And you can see here now there's plenty of room for the spinal cord. This is where the C7 laminectomy was performed. So this is just a before and after. You can see here before the area for the spinal cord was very, very small, and afterwards it's a pretty normal area now for the spinal cord. Just to get an understanding, this is an axial cut. The yellow is the spinal cord, PLL, posterior longitudinal ligament, and the spinal cord within the spinal canal should look similar to this. But as the OPLL progresses, it compresses the spinal cord further to the point where it's a serious problem. The surgery in laminoplasty, on one side, you cut halfway through the lamina, make a hinge, on the other side, fully through, and then you hinge it open, giving the spinal cord more room. Now that the spinal cord has more room, the spinal cord assumes a more normal shape, and a plate is applied here just to keep this lamina open until it heals. So this is just some more images to understand it. This is before and this is after. As you can see here, the spinal cord is compressed. This is the area for the spinal cord, and now there's a very large area of the spinal cord. And if you would obtain an MRI scan, which I did not because I felt it was not necessary, here this is what the spinal cord should look like. Next, the patient very graciously came in the office. He's 2.5 weeks out now to discuss the symptoms that he felt before and after the laminoplasty, and exactly his cervical stenosis myelopathy type symptoms in his own words. All right, today's date is October 13th, 2014, and Mr. D was very gracious to come and talk to us about cervical myelopathy. So just explain like what it's like. What were you feeling before?
Well, what I felt was a tingling sensation, and originally my primary care doctor thought it was neuropathy in my feet, and they were treating that with Lyrica.
Tingling in the feet and the hands, or just the feet?
No, originally it was just the feet, and then as time progressed, was treated for the neuropathy for a couple of years with medications and that.
When did you feel the tingling? Was it tingling at night, or was it while you're walking, or at rest?
The tingling was constant.
Constantly.
Constant.
So your feet were always tingling.
Yes.
Okay. So you had that for like years.
Right, and then started moving up my legs, mainly my left one knee.
So it started in the feet, and then it started going up your legs.
Correct.
Okay.
And what would happen is when I would walk, my left knee would sometimes it would lock, or sometimes it would just give out.
Your legs would give out.
Correct.
Mm-hmm. And then how did it progress?
It progressed worse, where I was starting to lose my balance.
How did you know your balance was off? Like, what happened specifically?
Well, what would happen is at work I would be just walking on the ground, and sometimes with construction you would stumble on like a stick or a rock or
something that you normally would just walk over, you would like fall down.
Well, it caused me to lose my balance, and then when I would try to catch myself, it's like my right leg would move over fast enough to catch it, and I just end up just tipping over, ending up on the ground.
So you felt like in your body where normally you would be able to recover and stand upright, your legs weren't working properly.
Correct.
And how about your hands? What did you feel in your hands?
It started tingling down in my fingers, and then it progressed, worked up my arms and up to my shoulders.
Mm-hmm. And what things could you not did you have difficulty with?
Uh, the hard things was, having to feel to pick something up, to carry it.
Like a coffee cup or like a
Well, like with a coffee cup, like the styrofoam cups, I would be standing there talking to my supervisor or something, and having morning coffee, and it would be like, all of a sudden, the cup would just drop right out of your hand.
so while you're talking, the cup would just drop out.
Right, if you didn't have a firm enough grip on it, and then when you think about it, and you start trying to hold things tighter because it's going to slip out, then you end up crushing the coffee cups because you couldn't.
So yeah, so you had no, so you felt like you didn't have that control where you could feel things just right.
Correct.
Sort of. How about buttons? And
I couldn't button shirts, picking up pens. I had to take this hand, put it in my right hand, and then get my fingers positioned, and it got to the point where you couldn't even read what I was writing.
You couldn't even read. And what things did you do to sort of cheat, to sort of make it work? Like some people say they had to look at it.
Yes, I had to look at everything. Like if I went down pick up a part to put on the machine or something, I had to actually look and make sure my hands were on it.
Right. So you were losing your ability. Basically, you're losing your ability to know where your hand was in space. That's part, and people lose that. Proprioception is what we call it. So to cheat, so to speak, people have to look at their hand while they're doing it, and then they know where their hand is in space.
Correct.
So you were kind of losing that. What about, you said walking, and like what things could you not do walking?
Oh, I couldn't walk a straight line. I was always like, if I was trying to walk in a straight line, I would be like maybe like 3-4 foot off, to one side.
Kept going off to the side.
Yes.
So what things? Now you're 2.5 weeks. When you first woke up, the first day or two from the surgery, what were the things that went away immediately?
Things that went away immediately was the numbness and the not having feeling in my feet, and the tightness that I had around my stomach area.
You felt the tightness around your stomach?
Yes.
That's interesting.
I forgot to mention that.
Yeah. And how about, what things are still left now?
I just have a slight tingling in my fingers right now.
So in your fingertips, you feel a slight tingling?
Yes.
Both sides?
Yeah, both sides. But
Okay.
it's
Okay.
100% better than what it was.
So the balance, you think your balance is good now?
Yes, my balance is pretty good now.
Good. Because I remember when you first came in, the other thing you didn't say is you were walking in the hall and you had to actually touch the sides of the wall a couple times.
Yeah, for balance.
For balance,
because of I would lose my balance.
You were losing your balance. So you had to say like a 8-month-old would, when they first walk, they don't have the balance. They have to put their hands out and grab on furniture, etc. to walk. So
right, like a toddler.
like a toddler. Yeah, you have those issues.
Sometimes it felt like like trying to walk a tightrope. How they always use the pole for balance.
Yeah.
I would hold on to the cars.
Yeah, you need
I
things.
was walking.
Great. Is there anything else that you want to say or comment on?
All I can say is I am grateful for the surgery. It's helped out immensely.
Me too. I'm glad I could help you. You had a serious problem. Okay, great. Thank you.